Now we've included a stray wire in the house that can be seen through the window with little shock symbols around it. This wire probably would have been fine had the house not started to burn down. However, now that sparks are flying everywhere, hopefully it doesn't shock anyone nearby. The wire and shock symbols have been included in this image to help you remember that Waterhouse-Friderichsen syndrome is associated with shock. Alright, that should be everything you need to know about Waterhouse-Friderichsen syndrome. Now let's move on and discuss other features of Neisseria meningitidis. We've now added a couple more characters to the scene. Notice that one of the Confederate soldiers is stabbing a Union soldier in the spleen. This is to help you remember that asplenic patients are at an increased risk of developing a Neisseria meningitidis infection. This should be pretty intuitive to you if you remember that the organism is encapsulated, but we've included this part of the scene to reinforce that idea. Remember, the spleen normally helps clear encapsulated organisms. Therefore, an asplenic patient is at an increased risk of developing severe infections from encapsulated organisms such as Neisseria meningitidis. As the Union soldier is stabbed, you can see that some pennies have started to fall out of his pocket and onto the ground. Just like in our other videos, we've shown pennies here to help you remember that Neisseria meningitidis can be treated with penicillin G. We've also shown this guy charging towards the Confederates with a trident to help you remember that Neisseria meningitidis can also be treated with ceftriaxone. Finally, notice that we've added a bunch of Union soldiers with rifles and bayonets to the scene. Rifle sounds like rifampin, so it will be our symbol for rifampin. The fact that these soldiers are using bayonets for close combat should help you remember close contacts. So putting these two ideas together, rifle and bayonet, we get rifampin prophylaxis for close contacts. So if someone develops a Neisseria meningitidis infection, then close contacts should be prophylactically given rifampin.